Sudden Halt: The Dire Consequences of USAID Halting HIV/AIDS Programs in Lesotho. An abrupt decision by the United States Agency for International Development (USAID) to cease funding for multiple HIV/AIDS programs in Lesotho, Tanzania, and Eswatini has left communities in dire straits. The decision, impacting an estimated 350,000 patients who rely on antiretroviral treatments, has been described as devastating by healthcare workers and program beneficiaries alike. In Lesotho, a picturesque but economically challenged country with one of the highest HIV prevalence rates in the world, the cuts are particularly painful. The Felisanang Bofalong HIV/AIDS Network, a community-based organization previously supported by USAID, is just one of many that have felt the immediate adverse effects of this funding withdrawal. Ribunajong Leoma, a project coordinator at Felisanang Bofalong, shared that critical projects had been providing specialized care and treatment for vulnerable populations, including LGBTQI+ individuals and female sex workers in the regions of Laribi and Maseru. These projects not only facilitated access to life-saving drugs, but also worked extensively to reduce stigma and discrimination in health facilities through education and advocacy. The decision to halt the funding was linked back to an order from former U.S. President Donald Trump, mandating an immediate stop to all activities. This move has left many healthcare providers and their clients in a state of uncertainty and disarray. Workers were pulled from fieldwork abruptly, without time to properly close down operations or refer clients to alternative healthcare providers. The implications are severe. Without active outreach and support programs, many are at risk of increased viral loads and new infections due to interrupted treatment, which could reverse years of progress in controlling the HIV epidemic in these regions. In addition to the cessation of treatment and outreach programs, the cancellation of an $8 million award intended to combat stigma and violence against the LGBTQI+ community has raised concerns about increased marginalization and health disparities. As a response, the Lesotho government and local health officials are scrambling to adjust, but the sudden nature of the funding cutoff has presented significant challenges. The country's health minister has hinted at the need for a substantial budget increase to mitigate the effects of the funding loss, but details remain vague and the path forward uncertain. This situation highlights the vulnerability of donor-dependent health initiatives and underscores the importance of building durable, locally supported health systems that are resilient in the face of international policy shifts. For now, however, the focus remains on addressing the immediate healthcare vacuum left by this unexpected policy change and finding ways to continue essential services for some of Lesotho's most at-risk populations. Thank you for choosing Satori News.